Coming of Age is coming up next. I'm your host, Emily Echeverria. First today, we're discussing symptoms, risk factors, and treatment options for diabetes. Next up, we're talking with Legal Services of North Florida about the legal resources you may need if disaster strikes. Finally, we're talking about the health risks of isolation and loneliness in older age and ideas for staying connected. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's wide range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll find the support and connection that you need to age well. Aging looks different for everyone, and we're here to help you meet your needs and thrive while maintaining what makes you, you. We've been in the community since 1972, advocating for elders and supporting those who care for our parents and grandparents. Now, join us as we discuss the age-related issues that matter to you. Over 1 million people are diagnosed in the United States with diabetes each year. 97 million American adults are living with prediabetes. To help us understand more about this disease that affects so many people is board-certified family nurse practitioner Miranda Jackson with Baptist Medical Group Family Medicine. Thank you for joining us today.
Glad to be here.
So first of all, tell us, what is diabetes?
So diabetes is basically a group of disorders that result in high blood glucose levels in the blood.
And what causes that?
So the most common forms of diabetes are type 1 and type 2 diabetes. So type 1 diabetics, these are the ones that rely on insulin. They're usually diagnosed at a young age. The cells of their pancreas, for whatever reason, at some point, the immune cells start attacking the pancreas, and it's no longer able to produce insulin, so their blood sugars rise to dangerous levels. And then type 2 diabetics, this is the most common form, usually diagnosed in people over the age of 45. Usually it's with excess weight. The pancreas cannot keep up producing the amount of insulin that's needed, so over time blood glucose levels just keep rising.
Mm-hmm. So that's the one that's more affected by kind of lifestyle factors.
Exactly.
So what are the symptoms?
So the three most common we refer to as the 3 Ps. So first of all, polydipsia, you just want to drink everything, no matter what you're drinking, you're still thirsty. Polyphagia, you just want to eat everything in sight, can't get full. And then polyuria, so you're just urinating a lot. Mm-hmm. And just generally fatigue, blurry vision. Diabetes can affect your vision. Slow healing wounds, and weight loss, specifically in type 1 diabetics, and then neuropathy, which people experience numbness, tingling, usually in their lower extremities.
Okay, and what are there controllable and uncontrollable risk factors that people should be aware of?
Yeah, so we break it up into modifiable and not modifiable risk factors. So modifiable, this is things that patients can do. They can change within their lifestyle. So smoking, living a sedentary lifestyle, being lack of physical activity and exercise, having pre-diabetes, that can be reversible. Being overweight or obese is another one, and then having uncontrolled high blood pressure.
Gotcha.
So then we break it up into the non-modifiable. This is what patients, kind of were born with, they can't change. So family history, first degree relative like mom, dad, brother, sister, being over the age of 45, having polycystic ovarian syndrome, specifically in women that have had diabetes during pregnancy, which we call gestational diabetes. If they delivered a baby over 9 pounds is another factor. And then being over some racial and ethnic backgrounds are more at risk, so Black Americans, Native Americans, Asian Americans, and Pacific Islanders.
Okay. So what are the ways that people can prevent diabetes?
So prevention is the best medicine. More so, this is aimed towards the type 2 diabetics. So quitting smoking if they're smoking, having controlling their comorbid diseases, so controlling their blood pressure, cholesterol, things like that. Physical activity, so the recommendations are 150 minutes a week, breaks that down into 30 minutes, 5 days a week. We want you doing things that increase your heart rate, so we call it aerobic exercise, like running, jogging, bicycling, and then also doing strength training, so trying to keep your bones strong, doing your arm exercises, leg exercises twice a week, and then also losing weight if you're overweight. So 5 to 10% of losing body weight can just help decrease those blood sugar levels. So for example, if someone's 200 pounds, losing 10% of their weight, which would be 20 pounds, can help lower their insulin level or blood sugar levels. And then dieting plays a big factor too. So portion control, eating smaller size foods, decreasing the carbohydrates that are consumed. So these are bread, rice, pasta, can really pack on pounds with people. And also decreasing sugary drinks, so sodas, teas, lemonade, juices, drinking water, decreasing fried fatty foods, eating home cooked meals. If you do go out to eat, maybe eating half of what they give you, putting the rest in a to-go box. So meal prepping at home, high fruits and vegetables, high fiber diet are some of the things to do.
Awesome. So if someone does have diabetes, what are the treatments that are available?
So in our type 1 diabetics, as I mentioned, these are the insulin dependent, so they are giving themselves usually injections of insulin before meals. They usually are monitoring their sugar, maybe making adjustments based on what they're going to eat, what their sugar levels are. Some patients have a pump that they use. And then in our type 2s, these are usually on oral medications, like most commonly is metformin, pretty safe and well tolerated drug. We can add on other medications as well, depending on if they have kidney disease, heart failure. We kind of pick different other classes of medications. And if they're uncontrolled on medications, we can give them insulin as well to help control their blood sugar level. And I can't talk about the medications without mentioning the most trendy right now, the GLP-1, the GIP. Most patients will know them as Ozempic, Mounjaro, Wegovy, that a lot of people are using for weight loss as well. So I always just recommend, if people are interested in getting on these, to talk with their provider, because as with all medications, there's side effects, contraindications, so just want to make sure that it's safe for you.
Mm-hmm. And I'm sure there's a lot of people that are asking about this because it has been seeming to be so effective, but there are some other side effects and things that come along with that as well.
Yeah.
So anything else you want people to know about diabetes and the risk factors, or when it's time to kind of get a check?
Yeah, I think the really good thing is that we can monitor your A1C every 3 months if need to, and that's kind of how we judge diabetes. And as I mentioned, if your provider tells you that you're pre-diabetic, it's nothing that you may need to worry about, but it's just something that you can keep an eye on. And maybe this is your wake-up call. I need to make some lifestyle changes.
Sure. All right, well, thank you so much for joining us today.
Thanks for having me.
Next up, we're discussing legal help for disaster relief. Stay tuned.
Navigating healthcare is hard. Baptist makes it better. With convenient locations, easy scheduling, and skilled, compassionate doctors, all when you need us most. The next time you need care, let Baptist make it better. Baptist Healthcare.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference.
Animal Allies is looking for volunteers, and there are many ways that you can help. From taking care of cats to using your computer and social media skills, any and all assistance is greatly appreciated. We have morning and afternoon shifts every day or help at adoption events. You can even foster a kitty at home. And it counts towards community service hours for bright futures. Find Animal Allies Florida on Facebook and Instagram, or go to aaflorida.org/volunteer.
Keeping your family healthy can be complicated. Baptist makes it better with trusted primary care doctors for the whole family and trusted specialists at convenient locations throughout the region ready to care for you. All when you need us most. Let Baptist make it better. Baptist Healthcare.
Legal Services of North Florida is a private nonprofit dedicated to providing civil legal assistance for those unable to otherwise access such services. They also offer valuable disaster legal services that citizens should know about as hurricane season wears on. From navigating homeownership issues to ensuring important documentation is in order, their expert advice can make a significant difference when disaster strikes. We have disaster coordination attorneys John Mays and Melissa Onaki here to tell us more. Thank you both for joining me today.
Thank you for having us.
Yes. So, what kind of services does Legal Services of North Florida offer?
Well, Legal Services of North Florida is one of 7 Legal Services Corporation funded legal aid organizations in the state of Florida. Every county in the state of Florida has a legal aid organization that provides free legal help to low-income and vulnerable individuals. It was started way back in the 60s under LBJ and Sergeant Shriver with a vision to provide free legal help and a voice to those who otherwise didn't have a voice. And so really the mission of Legal Services of North Florida is in line with Legal Services of Corporation, and that is we want to provide a fair game for those who normally don't get it and don't get legal representation. And it goes beyond representing people in actions. We are a point person sometimes to other organizations that provide funding support for housing and a variety of different issues. But that's generally what we do at Legal Services in North Florida, and we have a number of attorneys that handle all sorts of different areas. It's civil legal work. It's not criminal. And we have, issues that arise from anything from housing to education to healthcare to consumer issues, real property issues, and disaster legal issues, which Melissa and I deal with quite a bit.
All right. Well, what do you mean by disaster legal services? What does that entail?
Well, most people don't really think of legal services as part of the recovery from a disaster, but usually that is what keeps people from recovering fully is they have a legal issue. So as far as what our disaster legal services looks like, the first thing that I always try to do is be proactive, get the education out there with outreach. This is great that we're here today, so maybe some folks can prevent themselves from being in a really bad situation. One of the largest things that we see is that people need to have title to their property to be able to get the proper repairs done on their house, to pull permits. FEMA has loosened things a little bit, but most of the more local places that might provide aid, you have to show that your name is on that title. We have many people in our community that live in homes that were owned by grandma, and grandma passed away, and they've been living in there, they've been paying the property taxes, they're there. No, your name has to be on there. So basically estate planning, probate, those things that haven't happened before, and that can be a very long, lovely thing. It can take time. So we'd love for people to come and see us beforehand to try to help them not be in those situations. But other things, if your life has been touched by disaster and you're in a situation because of it, we will work on those cases. So bankruptcy, foreclosure, landlord, tenant, evictions, probate, estate planning. So yes, we try to be proactive, and of course we help afterwards as well.
And when it comes to those disasters, does it have to be a hurricane, or are there other types of disasters?
Hurricane's what we always think of around here, but it doesn't have to be a hurricane. Tornadoes, flooding. We've helped, of course, with the BP oil spill, COVID. Really, we get different types of grants that will help for different areas, but just because, we can fit it under a grant most likely with an LSC. We can help you out with it.
Gotcha. So tell us about the mobile office, the Justice Bus.
So the Justice Bus came about as an aid for disaster relief in our communities. It is a big old Winnebago, and it's got 2 private offices in it. So if your area is hit by storm, we can be there with the attorneys. We've got satellite internet on there, so we can help you fill out all those applications. If you don't have internet, we'll have AC. People can go in there, get some water, just relax, and get some legal advice about what's going on and where they can go as far as other resources, and just help doing all those things that a lot of times after a disaster, we just personally don't have that. But with the satellite and internet connection, then we're in a much better position to help folks. And if they just want some AC, they can come see us.
That's awesome. So is it income-based, or who's eligible for those services in that post-disaster time?
Yeah, and that goes back to, the inception of Legal Services Corporation. It is primarily income-based. Now, we at Legal Services in North Florida are fortunate to have an incredible executive director, Leslie Powell-Boudreau, who is amazing at going out and getting additional grants. We actually have grants. We have funding from Legal Services Corporation, Florida Bar Foundation, the Department of Justice, IRS, local area agencies on aging, United Way, and a number of others. So yes, it's income-based. And the goal obviously is to provide that legal help to the low income. Each grant is different in terms of percentage, what they look at. And then there's some grants that have exceptions if there's certain circumstances that would allow us to provide assistance to somebody that we normally wouldn't be able to, whether it's related to a disability or, it's age, obviously, very relevant here. We have grants that are catered specifically towards providing assistance to seniors in all sorts of areas that may come up for them.
So you really look for fitting the criteria of the situation to, whatever the grant criteria are for services.
Exactly. Each
Gotcha.
grant has certain restrictions that we have to comply with in order to provide this free legal aid. Our intake specialists, we have a number of them. We have 5 offices from Pensacola over to Tallahassee. We service all 16 counties. And we have intake specialists in each of our offices, and they know the questions to ask. If they're not going to qualify under one grant, ask these questions. They try and find a grant to fit these people under.
Gotcha. And before we go, just what does someone have to do to apply?
Applying couldn't be easier. The 2 ways we recommend: you can do it in writing, you can come up to the office. That's not as efficient these days. Everybody lives in the electronic world. So we recommend going online. lsnf.org is the website. That's L as in legal, S services, and North, F Florida.org, and click apply for help. That's for services here in our 16 counties. The quickest and best way so that you can talk to an intake specialist, call 850-432-8222. Let them know you want to apply for services, and they'll get you going. It takes about 20 to 30 minutes to apply. Some of the questions might seem personally invasive, but there's a reason behind them. Some may be case related, but a lot of it's related to a grant. So able to find answers to questions that would put somebody into a grant so we can provide those services.
Gotcha. Well, thank you guys so much for coming.
Thank you for having us.
Thank you for having us. This is great.
Stay with us. We're discussing the pitfalls of loneliness and isolation up next.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You alright?
I just feel feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad. Whenever you need to talk, I'm here, okay?
¿Qué color? Perfecto, mijo.
Gracias. Thank you.
What's wrong, mijo?
Donating to a pet's medical care is one of the many ways you can help families in your community. Pets and people belong together. Learn more at petsandpeopletogether.org.
Social connections are vital for mental and physical well-being, but many face isolation and loneliness as they age. These often overlooked issues can have dangerous consequences for older adults, so finding ways to stay connected and socially engaged is paramount for emotional and overall health. We're talking to Sara Kay, a social worker at Ochsner 65+, to get more details. And thank you for being here today.
Thank you so much for having me.
So first off, tell us a little bit about Ochsner 65+ clinic and here in Pensacola.
Yes, so Ochsner 65+ is a new primary care clinic on 1095 East 9 Mile Road. We offer customized primary care. So what that looks like is our doctors spending a good bit of time with our patients. I always say that our doctors really want to get to know you, not just as a patient, but as a person. And even outside of medical care, we do really fun activities at our clinic, from bingo to line dancing to cooking demonstrations. And even as a social worker there, I offer mental health therapy services, which is really unique to a doctor's office.
Yeah, that is unique. Let's talk about social isolation and loneliness in older adults. Can you explain the difference between the two?
Yes, so social isolation really refers to the absence of relationships and social interactions, whether that is with friends, family members, or even just getting out, whereas loneliness is more of a feeling. So one can feel lonely even when they are in a crowd of people.
Okay. And what are some of the primary causes of social isolation and loneliness in older adults?
So what we see a lot at in our clinic is things like transitions in life, whether that's retirement, moving into a nursing home, the death of a spouse, and even just not being close to your family or friends. That can be something that affects the older adults in our community.
And what are the potential health risks associated with prolonged social isolation and loneliness?
So we do see a higher risk for anxiety and depression, but not only mental health conditions, but medical conditions such as chronic illnesses, heart disease, hypertension. It can heighten those risks as well.
Okay, so it kind of exacerbates anything that
Yes.
is going on physically as well as emotionally. Are there specific signs or symptoms that might indicate that an older adult is suffering from loneliness?
Yes, so what we want to look for is social withdrawal, even changes in mood. If you notice someone is more sad than they used to be, maybe frequent crying, that can be something. Changes in sleep patterns, that's a big thing to watch out for as well. And even physical symptoms you can look out for is aches and pains.
Okay. How important is community involvement in reducing those feelings of loneliness and isolation?
So that is something super important. We want to get people connected. We all need connections and social interactions. And really just having a sense of community is going to be really important at any age in life, but specifically once we retire, we might not have the job that we used to. So we want to get you out and about and connected and have that sense of belonging.
How can older adults take proactive steps to stay socially active?
So there's several steps you can take. You can join a club, you can go to your senior centers. Of course, our clinic, we offer so many activities that you can find on our calendar that really advertises to a bunch of different unique activities and fun things, and so really getting involved in those interest things that you would like to do.
Mm-hmm. I know one of the things that Council on Aging offers is our senior dining sites, and that is it's a free hot meal, but what it really is fellowship and community,
Mm-hmm.
and giving you a community of people that
Mm-hmm.
know when something's changed, know when maybe you're sick, and they're checking in. It's that social connection that is so
Mm-hmm.
vital. So what are some of the activities that you have at the Ochsner 65 Plus place?
Yes, so one thing we do on Tuesdays and Thursdays is we do a fitness group, which is really fun. We do that for our patients. We mentioned some cooking demonstrations. Chef, and we've had him a few times. He's super fun to watch. We do bingo, which is a big hit at our clinic. And of course we have a fitness center that patients can use really any time of the day. They can come up. And we love just talking to our patients. We have a community room for that, so people can just come and hang out.
Okay, so it's also a place that just has a sense of community, some fellowship for
Yes.
people to come and interact with others, with their peers. So for adults over 65 who are interested in learning more or becoming a participant, where can they go for information?
So you can directly call us at 850-558-4665. Also, just come up to our clinic, get to know our staff. We would love to get to know you and give you more information about our program. We have a Facebook page, Ochsner 65 Plus Florida, and then ochsner.org/65 Plus Pensacola.
Okay. And what do you see personally with patients that are coming in and taking advantage of some of these opportunities to connect with others?
So one of my favorite things that I've seen since working for Ochsner is having a patient come in and they might be hesitant at first, and then they get to know our staff, they get connected with the doctor, they get connected to mental health services, and they really take advantage of our activities that we offer. And we really see just a whole transition in that person. And so I think just our staff loves to see that we really do care about our patients, and we want to see them excel in life and really feel empowered.
Excellent. Anything else about Ochsner 65 Plus that you want people to know?
Just truly that we care. I can't stress that enough. I'm a social worker, so I really value just mental health, especially in older adults. I think it's something that we definitely need to be talking about more. And so something that I love is just how, intentional our doctors are, and not only our doctors, but just our staff up front and the back. And so I think just if you want to come to a place where you feel welcomed and you feel seen and your concerns are taken care of, that's going to be our clinic.
Awesome. Thank you for joining us today.
Yes, thank you so much.
And thank you for watching. Until next time, enjoy life. You've earned it.